Welcome, everybody, to today's webinar. I am excited that you are here. We are in for a real treat. If you're here to learn more about how you can have smarter health benefits and you can have more value, lower costs for your employees, you're at the right spot. Before we get started, I want to go over just a few housekeeping things. First of all, engage in the chat. So if you have a question, go ahead and put it in that chat. It's in the bottom right. And today, let us know, are you currently offering health benefits to your team? Yes, no, working on it. Maybe you've always wanted to, but thought you couldn't afford it. That chat is usually located in the bottom right. And then these are free webinars that we would not be able to offer for free if it wasn't for the great sponsors um, of the sponsors that we have. So first, we want to thank Wells Fargo. Today's webinar is supported by Wells Fargo, a trusted financial institution committed to helping individuals, businesses, and communities succeed. With a long-standing reputation for providing banking, lending, and financial services, Wells Fargo offers valuable tools and resources to support small businesses as they grow. So we're grateful for their support in making opportunities like this webinar possible. So thank you again for investing in our community. We also want to do a shout out to Lee's Crossroads, a proud Grow Nebraska member since 2023. They're located in Arapahoe, Nebraska. And trust me, I've been there myself. The food is absolutely delicious. But really, what stands out is the quality and variety that they offer. From elevated smash burgers to Chinese dishes, seafood, and a full kids menu. And they also have rotating specials. It's truly a treat every time you visit. So it's one of those hidden gems that everyone should experience. So if you're in the area of Arapahoe, be sure to stop in and check them out. We also have an entity of our Grow Nebraska Women's Business Center. It is in Omaha. And so if you're ever in the Omaha area, be sure to check out the trainings they host live, as well as if you have ever wanted to connect with resource providers. Bail is banker, accountant, insurance, and lawyer. Make sure that you make time to be a part of that opportunity. Grow Nebraska is a nonprofit, and we offer these trainings free because we want all businesses to be able to live in anywhere in Nebraska and make a sustainable living. And so if you've ever wanted to know more about being able to get a digital footprint, networking, tailored coaching, or just support in what's next for your business, feel free to reach out. We'd love to have a conversation or at least help you make the right connection so that you can grow your business where you'd like it to be. So with that, I don't want to take any more time. I want to get right to it so that we can learn more about health benefits. And so I am going to let Mac take the stage. So thank you both, Mac and Chris, for being on today's webinar and sharing this information.
Thank you, Janelle. Really appreciate you inviting us, and I'm really looking forward to speaking to all your members. Let me share my screen. Okay. Can you see that?
It's perfect.
Okay, great. Well, again, thank you so much for having me. And I also have a guest that's going to join me. This is kind of a surprise because we didn't mention this in the advertisement, but Chris Broker. Okay, he's with Ensure Wellness. And so we're also going to introduce to you a wellness program that I think is just amazing for small to medium-sized businesses. So let me get started and kind of tell you why we do what we do. Now, I'm with Trek Insurance Solutions, and we're working with a lot of small to medium-sized businesses today trying to find a much better solution for employee benefits. And here's kind of why. Okay, when we look at the statistics that we're dealing with today, we're finding that, and this is probably the biggest problem, and this is for big companies too, is that the health insurance premiums are increasing at a rapid rate year after year. So as you can see, a 9 to 11% is what's projected, and that is just for this year. So next year, it may even go up higher. So it's not affordable almost anymore for companies to be able to offer group benefits, but the big companies have to. Now, the small companies want to. The problem is they can't afford it. So that's why 2 years ago we started looking at what can we do, because we know there's a need, but what is the solution for small businesses and medium-sized businesses that cannot afford health benefits for their employees, but they need to for various reasons. So this cost crisis that we're talking about. Now, when I told you 11%, actually for small businesses, some of these premiums are even higher. It goes from 6.5% to 26% in 2026. Well, that's not sustainable. There's no way a small business can do this, but they want to, because if they don't offer their employees benefits, they have a great chance of losing them. So we knew we had to find this solution, and that's what I'm going to present to you guys today, is what we've come up with that's out there in the market that we have been able to say, okay, will this fit with small businesses? And we're talking about businesses under 50 employees. And will it work for also companies that have more than 50 employees, but just can't afford the increase year after year? So part of this reason for why this is so important to businesses is the talent war, okay? We know that 78% of employees rate benefits as one of the key reasons why they're there. Now, an interesting statistic, with the premiums increasing year after year, this may surprise you. I went and looked into how many companies are dropping their benefits today. They're just saying, I can't afford this, and we're talking about medium to large size businesses. So what percentages of these businesses are dropping health benefits to their employees just because they can't afford it? Well, this may surprise you, but the answer is zero. Now, why is it zero? Because they can't afford not to offer it. So companies are kind of trapped. They're put in a situation where how do we offer better benefits to our employees, but at the same time be able to afford it? So here's our answer. I'm going to introduce to you 3 programs, 2 that's going to be about healthcare, 1 is going to be about wellness plans, okay? ICHRA and QSEHRA. And I'm not sure if any of you are familiar or have even heard of these programs before, but that's okay. That's what I'm here for, is to try to explain this as much as possible. Also, if you guys have any questions, please interrupt me. I have no problem with that, and I'll do the best I can to answer them. So, what is ICHRA? Okay, it stands for Individual Coverage Health Reimbursement Arrangement. Okay, and we kind of look at this as a budget control model, but it's actually a little bit more than that, because the employer gets to define the contribution, and the employees, they get to choose their own carriers. Now, why is this different than big group plans? Because big group plans, number one, really don't give their employees the opportunity to individually choose what they would like. So they're kind of stuck with whatever the company says, here, this is what you get. Say, in this case with ICHRA, you're able to do both. The employer can define the contribution, meaning they can cap it. They can say, okay, I'm gonna put in $200 per employee, and they can get whatever they'd like. So the employee is pretty happy. The employer is happy, because now that removes the risk of a bad renewal year, which, as I said earlier, is what's killing a lot of companies today. So what's it best for? Companies wanting to fix their budget forever, and employees in multiple states, and can work for any size business. Now, even though I mentioned small to medium-sized business, ICHRA actually can work for anyone. Okay, now, how it works. So you set the tax-free monthly budget, okay? Employees buy the plan they want on the private market. So this is completely set up for them. So the employees can choose the plans. The employer chooses how much they're willing to put in. Okay. Now, we talk about the company benefit. Well, it's 0 renewal increases. This is huge, because as I showed you before, I mean, in some cases, it can go as high as 26% each year for these companies. Well, now they don't have to worry about that. So the budget stays flat. And it works for employees of a lot of different ways. So it's kind of, you might say it allows employees to divide their workforce. I mean, employers to divide their workforce into different sections. So that could be hourly, they could be in different locations. They can just choose how they want to give money to their employees for these benefits, and they can push this across a wide range. So this is why a lot of people will pick ICHRA. Actually, the numbers are increasing considerably right now. In 2026, the numbers for employees in the United States that's on ICHRA is reaching close to 700,000. So as you can see, this is a fast-moving program. And the companies that are choosing this, 83% of them that are choosing ICHRA or QSEHRA, this is their first time offering employee benefits because they couldn't afford it before, but now they can. Now, and by the way, if you guys are wondering, well, did companies like it once they chose these? I mean, is this really working for them? Is it really working for their employees? And the answer is yes. 80% renew year after year after having ICHRA. If you guys have any questions on ICHRA, you can ask me now or you can ask me later. So Janelle, you want me to just move on? Okay.
Yep, no questions yet.
Okay, QSEHRA. Well, we kind of call this the small business starter. This is for, we find that a lot of companies who have never been able to offer employee benefits will offer this. They'll say, okay, this is my first shot at this. I have to do something. And so I'm going to pick QSEHRA. Okay. So as an example, maybe you have 3 to 10 employees and you're just starting off to offer benefits. Okay. This allows you to reimburse employees tax-free for their personal plans without a complexity of a full group administration. Again, this is for businesses with less than 50 employees, but it's an amazing program because it just makes it so simple for companies to do this. And the flexibility and the options that they can offer with QSEHRA are just endless. So this is why a lot of small companies for the first time will pick QSEHRA as their health benefit solution. The benefit, it's low. I want to mention this too. It's extremely low administration burden because companies who have offered health benefits to their employees, they've kind of had some administrative issues, meaning how much is their HR department really spending time on this? Or someone in their company that's been chosen to like, hey, I want you to work with the employees. I want you to work with the program and just make sure all this works. Well, it can be a huge burden. Well, with QSEHRA, they don't have that burden. Actually, one company that I looked at with QSEHRA, their HR person only spent 5 minutes a month. That was it. So again, great program, great benefits, gives the employees the ability to choose what they'd like, gives the company the ability to put the money in that they are willing to spend, and it's been a win-win-win situation for all of them. So let me just quickly do a recap for you. So ICHRA, fixed budgetary control. You set the defined tax-free monthly allowance. This is where the company says, this is what I can afford, this is what I'm willing to do, and they set that. Okay, now it gives the employee choices. And as I said earlier, this has been huge because, by the way, we've seen companies that have also implemented ICHRA and QSEHRA have shown an increase of 20% of their employees have done much more to be a part of the program than they were when they just had large group benefits. So increasing their participation by 20% shows that the employees really like this program much better than what they had. And there is no minimum participation, okay? They have no minimum participation requirements if you have ICHRA. And then there's obviously the maximized tax efficiency. And as I said, it's really a win-win for your bottom line, and it's 100% tax deductible. So for QSEHRA, sounds a little bit like ICHRA, but it's a little different, okay? You have total budget flexibility. It means, well, with ICHRA, whenever you offer health benefits, it has to be federally approved that it's truly health benefits because of the tax benefits and stuff. ICHRA, with QSEHRA, you don't have that. It's completely flexible, no minimums, and there is really no minimum contribution requirements. It's simplified. It's a set and forget. Again, this is why so many small companies that offer health benefits to their employees choose this for the first time because it's so easy to work with. And then again, you have personalized coverage, so the employees aren't tied to a company pick plan. And again, tax-free for everyone. So financially, it's really strong programs. For the employer that wants to say, I don't want to spend more than this, they can cap that. Their their premiums don't increase year after year, which is huge because this is what is killing these other companies right now that's been offering employee benefits. And then the bottom line is the employees love it. The employees think these programs are much, much better for them. Um, so this is kind of where I hand it off and let Chris Broker, who is with Insure Wellness, speak to you guys about the wellness program. And as I said earlier, and I'm not blowing smoke, I was blown away by this wellness program that he has and how it's helping small businesses today, not only helping their employees, but also helping the companies financially. So, Chris, I'm going to let you take it from here.
That's a great introduction, Mac. I appreciate the handoff. I'm gonna start sharing my screen um, here in a second, and then we'll get started on the Insure Wellbeing program. Perfect. So, like Max said, just quick introductions. My name is Chris Broker. I am EVP of Sales for a company called Healthcare Interactive, or HCI for short. I want to thank everybody for taking the time today. I really do appreciate this opportunity. What I'm going to be walking us through today is a program called Insure Wellbeing, or IWB for short. You can think of it as, in essence, a well-being program on steroids that really does accomplish three things at the end of the day. It offers your employees better benefits. It generates real hard dollar savings for both the employer as well as the employee, all with creating minimal disruption for you all on a day-to-day basis. So by the time we're done today, my goal is to show you exactly how that's possible. This slide really quickly just introduces us as a company. Again, kind of who's behind this program. We're HCI. We're the program administrator for the Insure Wellbeing program. You can think of us as a 20-year-old health tech company with over 3 million lives on our platform. We work with a number of A-rated carriers across the insurance, healthcare, wellness space. And I want to encourage you all to think of us as not just another vendor, but really that compliance technology engine, if you will, that makes a program like this actually work and work cleanly. So a lot of the same themes Mac outlined in a couple of his slides are some of the topics I just want to reiterate here today. Because as employers, many of you might know this already, but putting numbers on a slide and showing these statistics is quite compelling because you can see it here, right? Many employees are facing significant financial pressures, like 2 out of every 3 Americans living paycheck to paycheck. The average household carries about 9,000 in credit card debt. And even two out of every 3 bankruptcies in the US can be tied back to some medical issue, whether that's a big bad medical bill, time away from work, or both. And together, what this shows really is that need or urgent need for affordable health benefits to protect employees from financial hardships and bankruptcy in some instances. And that's really what this Insure Wellbeing program is designed to solve. So what is it? What is IWB? Again, you can think of IWB as a wellness program on steroids. It's a employee benefit that provides extra protection, really income protection for your employees through wellness, population health, and wellness well-being programs. By adding this program and offering it to your employees, what it does is it decreases payroll tax costs for you, the employer. It expands options with affordable benefits. It enables employees to become smarter, more efficient consumers of healthcare, all while promoting a culture of health and financial well-being. So at the end of the day, it offers better benefits to the employees and allows those individuals, as well as their employer, to save more money in the process. Now, the numbers that you guys are probably most interested in, because I keep talking about savings, are shown here. So on average, this program generates a little over $1,000 in annual net FICA payroll tax savings for each employee enrolled in the program. That's savings to you, the employer. And you can see how that scales from businesses as small as 10 employees to businesses as large as 500. This program is designed to support groups, businesses of all shapes and sizes. And then on the employee side, the value is just as substantial. The average employee sees about $3,200 in annual value. There are three key drivers behind all of this. And we'll get into kind of the mechanics, the funds flow, and how it really works in just a second. But you can see it here, roughly about $655 in increased net take-home pay from pre-tax savings, about $2,500 in premium costs being covered by the program itself, as well as helping to cover the cost of any out-of-pocket medical expenses. So again, we'll get into how it works. But for now, I just want you to let these figures sink in a bit and take away that employees are bringing home more, they're spending less on healthcare and gaining real financial protection at the end of the day. And for you, the employer, very little additional work is required. Just a couple more slides, just important guardrails I think worth calling out. This program, it's available nationwide. It's backed by carriers like you see on the screen, A-rated, trusted names, strong financials. But a question we get a lot that we like to address kind of proactively is, if this program works so well, why isn't a major carrier like, an Aetna or some other names you may be familiar with already offering it me today? And it's really because administration of this program requires three core capabilities. You can see them listed out here. Carriers typically handle one or two of these, like claims, but they don't offer payroll integrations or kind of the different things we're doing on the tax side and the wellness side quite like we do. That's what makes our company, our program different. We sit at the intersection of benefits, wellness, payroll, finance, because that's really what makes this work and why we're able to deliver it so efficiently. Okay. So really quickly, just touching on the mechanics, kind of how this program works from both the employee's perspective and the employer's. What we've done is we've kind of just created a sample employee profile. So take Sarah here. She's a single full-time professional, maybe an operations manager at her local business, making about $55,000 a year. What we'll go through is what her paycheck looks like, both current state, not enrolled in the program, and what her paycheck would look like should she choose to participate in the Insure Wellbeing program. So we're going to look at things from a monthly basis, but at the end of the day, right, her gross pay is about $4,500. She's got her existing deductions for maybe her medical, her dental, her vision plan. That results in a taxable income of about $4,350. She's got her payroll taxes taken out of that. That's your federal tax, your Social Security, your Medicare, your state, local in some instances. So at the end of the day here, Sarah's walking home with about a little over $3,500 each month in her paycheck. That's current state, not enrolled into this IWB program. Now, should she choose to enroll, her gross pay stays the same. We're not touching salaries. We're not touching wages. And currently, her existing deductions stay the same as well. We're not touching her existing benefits. The only thing that's changing is Sarah's enrolling into this IWB program, which gives her access to a well-being program, a whole host of tools and resources to improve her personal health and well-being, as well as providing her access to two additional pre-tax benefits. One of them is a medical gap benefit. What this does is help cover costs like your deductibles or co-insurance balance. And then the second is a hospital indemnity benefit, which provides coverage for things like hospital stays, ambulance rides, ER visits. But the interesting thing about this HIP hospital indemnity benefit is that by participating in this well-being program at least one time per month, doing just one simple activity, Sarah will actually receive a claim payment sent directly to her to offset the cost of these additional deductions and even allow her to take home a little bit more money. And we'll show you exactly how that kind of flows through here in just a second. But you can imagine with these two additional pre-tax benefits, her taxable income is reduced. The amount of payroll tax getting taken out of her check is also lower. And when you compare just quickly net, her paycheck, yes, it's lower. But by engaging in this well-being program one time per month, she receives this claim payment, again, to offset the cost of these benefits and allow her to come out about $20 more each month in this sample. And what she's taking home really is access to a robust health risk and well-being management program that provides her access to health coaches, online education resources around all the different dimensions of health. We know at the end of the day, it's not just physical, could be mental, could be emotional, could be spiritual. Our program supports all those different aspects. And just by doing one simple activity, she receives that claim payment each pay period, again, to cover the cost of these additional deductions and allow her to take home more money, close to $240 more per year than not being enrolled in this program. That's from the employee's perspective. And then what do you, the employer, see? As you can imagine, right? Because of Sarah enrolling into these two additional benefits, what that's doing is that's lowering her taxable income. It's also lowering your employer FICA matching responsibility. So that 7.65% you have to match for each of your employees. Because that taxable income is lower, your FICA matching obligation is also lower. So you can see in that Sarah example alone, her employer would be saving a little over $1,000 just by having her enrolled in this program. When you extrapolate that out or scale that out across the size of maybe a 50-man workforce, assuming 80% or so enroll in the program, that's how we're arriving at that $40,000 in annual savings through the IWB program for you, the employer. So just to bring it all back together, right, we're seeing a little over $1,000 average savings per enrolled employee, up to, on average, $3,200 in employee value, a genuine win-win for both the employer as well as the employee. Okay. Now, seeing I know is believing, and I think Mac will get into next steps when I kick it back over to him. But just to quickly say, right, we're always happy to run kind of sample proposals for you all to show you kind of what your savings would be, both at that employer level and then what the impact would be on an individual employee by employee basis. That way you can see exactly what this would mean for you and your business. Great. Those are my slides. So Mac, I might kick it back over to you to finish yours.
Yes, thank you very much, Chris. Let me share my screen again. Okay, so we get this question a lot, and that is, okay, all this sounds great, but how are you going to do this? Well, we have a process that we go through with every company that we meet with. Okay, first we're going to meet with you. We call it our discovery part, where we're going to ask you questions, find out what your goals are, kind of what you're willing to spend, what you're trying to offer your employees, and what you're trying to accomplish as a company. And then we come back and we do an analysis. And I have to tell you guys, almost every case, it's custom. So every company's different. Every company's needs are different. So we come back and we do that analysis, and then we come back to you with a custom proposal. And by the way, none of this costs you anything, okay? We're doing this. We're going to meet with you for free, come back to you, give you a proposal. There's no obligation, nothing. There's no charge in any of this. So we meet with you again. We talk about what we've discovered, the options that are out there, and what we can do for you. And then if you say, great, well, now we go into the implementation part of our process. And we do all the implementation, but the best part is we don't just hand this off to you. We don't just throw it in your lap and say, hey, here it is, great, good luck, and that's it. No, we're with you through this whole thing. That means also support. So we're working with both the employer and the employees to make sure that the onboarding and everything is done properly. So we're with you through this entire process because our job really is to help you. We're not here to just try to sell you something. That's not what this is about. We really want to try to help you, and we want to provide you with a program that's going to benefit all your needs. I kind of mentioned Trek Insurance earlier. Some of you may know us, some of you may not. But our big thing is we do everything really custom. And we work with companies, we work with individuals. We've been doing this for over 20-some years. Most of our processes are pretty unique, but they're all designed and developed to be able to support what the company's needs really are and what those goals really are. We also provide you with reporting so you know everything is working and how it's working. We try to do everything we can to be an extension of your company. We feel that's really, really important, and that's why I said we're going to be there to support you, okay? And we're going to be there to answer your questions and help with the onboarding and all those steps that are really important. And then cost containment, it's always important to companies today is how can I afford this? And if I can't afford this, what is my employees going to get for this? And what am I going to get for this? So we work with you and give you as many options as possible. And we do have a lot of options. So far with the companies we've been working with, we've yet to fail providing them with a solution that really fit their needs. So we've been pretty happy about that. So how does this start for us? Well, you just schedule a meeting with us. It takes about 30 minutes for our discovery session, and we take it from there. We meet with you. We ask you these questions, and as I said, no pressure, no obligation, just a proposal and a plan for you that we think will help you. Okay, well, that's about it, unless there's questions.
We do have questions. First of all, thank you both, Mac and Chris, for just diving into this. And so I do think it's important. We had some questions in the chat. Ben's been grateful and has been answering them, but just for those who are maybe watching this recording or haven't been following along in the chat, I want to kind of read through those. And if you guys have any additional information you want to chime in with, I want to give you that opportunity. But we had someone ask, do you find that most places accept this insurance, such as medical offices, etc., especially through the QSEHRA? And Ben did answer this and just kind of broke down that stereotype that people are thinking about. So there is no network. It is a program that they help manage to help your employees with medical expenses or insurance. So you set the budget and then you guys can help administer the dollars. Any other thoughts on that you guys want to address?
Well, they say the employee picks the plan, and these are ACA plans, okay? So the employee picks a plan, so the doctors and everybody is very, very familiar with any of these plans that they choose.
Beautiful. So you can make sure that whatever area most of your employees are in, they're going to be able to use those local like hospitals or doctor offices so that it actually is a true benefit for the employee.
Yeah, we should be able to do that. I mean, obviously, as I said before, it's all customized. So once we meet with them and kind of look at what they're looking at and what they'd like to accomplish, and also based on location, that's really important. So we would look at all of that and then be able to answer that question.
That's great. And then I think this next one just kind of falls in that same line of thinking. They were wondering, what are the deductibles, copay, out-of-pocket maximums? It sounds like that falls back on the employee to determine kind of what plan fits best.
Yeah, I think so. I mean, I'm not an expert on this part at all, but yes, I mean, again, remember the employee's picking the plan. So each plan is going to break all of that down for them. So they'll know what they're spending, what kind of benefits they're getting, what their deductibles are, et cetera.
Awesome. Um, and then a couple more questions came through. So at one point you had said that this plan fits if you are a small to medium company with less than 50 employees. This person wants to know, would they still qualify if they are currently a sole entrepreneur and have not hired anyone else yet?
I don't know. I really don't. I don't think so because, well, again, I'm not sure because ICHRA, okay, you do have to be able to show you're offering true health benefits to an employee, okay? Now, even though it breaks it down to salary or hourly or location and things like that, that's why I'm afraid to say for sure because they do have to fall under a certain classification that would be considered an employee.
Okay. So maybe it's best just make connections after this and you guys can
Yeah,
dive in a little deeper, or even if this person, if hiring someone in the near future is something that it can definitely be a resource that you can consider to make it more appealing to hire the right fit.
yeah, absolutely.
Another question we had come through is how easy, I think this one's more for you, Chris, is how easy or difficult is it to submit the well-being activity that you participate in monthly? And they specifically want to know if you have any examples.
That's a great question. Yeah, and it shows me folks are really thinking about the program. So the best part about thinking about do I have to submit activities or anything like that? No, you don't. What happens is in essence, employees are given access to a member portal where all of those activities are kind of hosted. And our system tracks what is done on a month-to-month basis. So there's nothing that requires submitting any paperwork or shooting an email off or anything like that. You simply just log onto your account. You can complete any one of those activities. And in doing so, our system tracks it and kind of monitors things from that, I guess, compliance standpoint. And some of those activities, right, there's a wide array of them because we know all employees are different, all workforces are different. So that's why we have to offer enough to be able to accommodate essentially everybody. So those activities could be as intensive, right, as calls with a health coach. So we provide access to on-demand health coaching where you can dial in and speak to someone, a certified professional, about what your unique health or well-being goals may be. Maybe you want to exercise more or have a better diet. You could have those consultative sessions there, and they would help develop a plan for you to help accomplish those. Other activities, like I mentioned on the call, could be, or earlier in my presentation, could be going through different videos, pre-recorded webinar sessions, completing online educational modules or resources around different areas of your health, right? So we have different topical sessions on maybe cardiovascular care, stress management, financial planning, family fitness, just to give you guys an example on some of the topics that our program covers. One could go through, access some resources like reading materials, videos, maybe some knowledge checks to ensure you're retaining some of the information. All of that again would give you credit for that month. And then it could be as easy, honestly, as reading an email, because at the end of the day, by enrolling to this program, employees receive a weekly email. In that email, it shows them what's their status for the month, as well as some tips and tricks and resources that they can use towards accomplishing certain goals on their wellness journey. And just by going through that email, that also counts as credit for your well-being program. So just a sampling, right, of some of the activities and what we're able to offer through it.
Wow, thank you for explaining that. It sounds like, it's really topics that cover a vast. So no matter who's on the plan, hopefully there's some sort of education you can help to better yourself and that they make it almost pain-free, dare do I say, for insurance, which is very unique as well.
Right.
Thank you for answering that. Another question came through. So they wanted to know, can you discuss more on how removed you can be? I think directly, how you said, HR spent 5 minutes. So they specifically want to know, are you saying I can send my employees to you for questions or to make sure they are enrolled properly? Or can you just elaborate more on that part?
Yes, the answer to that is yes. That's what we mean by support. And we
Awesome.
do and we do as much as possible in the beginning when we implement this program so that people they know what to do, clearly know what to do. But yes, as I said, we're an extension of your company, and that's how we work. And we find it works much, much better for companies and their employees.
Yes. So if anyone has more questions, please feel free. We have a few minutes left, but I do want to reiterate, and Ben has said it nicely in the chat as well, that each plan is customized to each employee and their unique situation. And so it's really about finding what's going to benefit your company, your employees, at no cost. So this is no cost, no commitment plans. And then they are an extension of HR. So it truly is as good as it sounds right now. So if you guys are interested, there will be a follow-up email. We'll have this recording. You can rewatch it. You can also have their contact information. It will be for anything that was covered here today. And so thank you both, Mac. Thank you both, Christopher. I am going to give everyone a couple minutes to kind of digest. If they have more questions, they can put it still in the chat. Um, if you liked today's webinar as much as I enjoyed it, please give us your feedback. It's a really simple form, couple questions. If you have topics that you want us to cover on future webinars, please let us know. We're always looking to bring businesses more content that's going to help them grow as a business. So please be sure you give us your feedback. And then I just want to promote a couple additional trainings coming up. So on May 21st, it's how to attract clients through your values. And so you won't feel like a salesperson. You'll just feel like you are talking about the passionate business that you have. On May 28th, we have Build an Aligned Business, a fresh approach approach to sustainable success, which I think can be very relevant right now. And those are just a couple teasers of what's coming up in May. Please do make sure you register and sign up. Just like today, you'll get the recording and be able to ask very specific questions. And we want to again thank our sponsors for making these free for the public. And please submit your feedback so that if we have any topics you want, we can learn more about. And I don't see any other questions. So with that, thank you everyone for your time. Thank you to both of our wonderful presenters for bringing this information to us. And we look forward to seeing everybody on another future webinar.